Hi, I'm Sunil Solomon. I'm the managing trustee of YRGCARE Medical Education and Research Foundation. In Kaila, we opened the Suniti Solomon Center. The center, it's like Ore building. We have clinical care, we have research, and we have labs. The purpose of this building is to really build capacity within India to do clinical trials, clinical research, develop antibodies, and really get India ready for the next pandemic and get India ready to solve the existing pandemics on HIV, TB, knowing Allah, find out what is the problem, what is causing it, and give the young researchers and scientists the the uh, the tools that they need to be able to solve this. இன்னைக்கு சாயந்தரம் we had a scientific symposium. I think we have a lot of guests who have joined us. From the side, there's Professor Gregory Lucas. He's a professor of medicine at Johns Hopkins University. He's been working with people who inject drugs in India almost for 20 years. அவருக்கு பக்கத்தில் Dr. Shruti Mehta. She is the chair of the Department of Epidemiology at Johns Hopkins. So she's also been working in India for almost 2 decades. And Dr. Amita Gupta. She is the chief of the Division of Infectious Diseases at Johns Hopkins University. She's also been working most in TB and HIV in pregnant women for almost 2 decades. Dr. Mark Salkowski. He's a professor of medicine at Johns Hopkins University. He's also the senior associate dean for research in the School of Medicine. Dr. Gavin Cloretty. He is the head of infectious diseases research at Abbott Laboratories. Dr. Paul Orwater. He's like the clinical director of services at Johns Hopkins University School of Medicine. இன்னைக்கு சாயந்தரம் we had a panel on identifying previous COVID-19 எல்லாருக்கும் தெரியும் அதில் what worked, what did not work. அடுத்த வாட்டி இந்த மாதிரி பேண்டமிக் வருதுன்னா what should we do to prepare ourselves for this pandemic. அதை பற்றி ஒரு டிஸ்கஷன் வச்சுருந்தோம். ப்ளஸ் டாக்டர் அமிதா குப்தா she's heading the Johns Hopkins India Institute. அவங்க அந்த ப்ரோக்ராம் பற்றி Johns Hopkins Association with India பற்றி ஒரு 2-3 லைன் சொல்லுவாங்க. Go ahead and say.
Well, thank you, Sunil, and hello, good evening to all of you. So I'm Dr. Amita Gupta, and at Johns Hopkins, we've been working with India now nearly a century. And as we've learned from the COVID pandemic, treating global challenges requires global collaboration. And it's something that we're very proud of, that working with many of the all over India to sort of work and address big global challenges such as infectious diseases, maternal child health, artificial intelligence, looking at health system strengthening. These are just some of the areas that require global solutions. And so by coming together with the best of some of the Indian institutions and the Johns Hopkins University, we've established the India Institute to create a super highway of collaboration and engagement. And we look forward to sort of being able to take on big challenges together.
So you want to answer this now?
What was the one difficult thing which could have been avoided or which can be?
So in the previous pandemic, of all the different things that you're saying, what is that one challenge which you learned in the previous pandemic that we can prepare ourselves for the next pandemic?
Well, there are many lessons learned from COVID-19 and how we move forward. I think one of the major lessons was the need to come together and work together and collaborate both with our own internal teams, but really across the planet, but also to communicate the research findings with that same uniform voice so that people around the world can learn from data derived from clinical research rather than other means that may not be scientifically valid.